एक मिनट
Additions to Dr. Umar, Balochistan has adopted the Punjab Pure Food Rules 2018 as it is. So now we also have Pure Food Rules in Balochistan, and they are working to form the rules for those regulations. We also have Network for Consumer Protection in the civil society organization who are working for TFA elimination in Pakistan. And as you mentioned about the harmonization, based upon the standards of Punjab Food Authority, a request was submitted to Ministry of Science and Technology through Ministry of Commerce and Ministry of Health that partially hydrogenated oil or vanaspati should be banned in the entire country, and it is under consideration in PSQCA also. Once again, thanks a lot, and now I would request Mr. Omar Rashid for his presentation of TFA elimination, a situation analysis.
Thank you, Dr. Faza, to Dr. Serena and our guests for the evening. Dr. Tarer has, I think, pretty much described everything of importance to say. I don't have very much else to add, but I will try and focus a little bit on an analysis of the situation and try and understand particularly what we can learn from other countries' experiences with TFA, and take a health systems approach to understand what kind of steps we need to take to ensure we can address this problem quickly. So there have been, in recent years, there have been several approaches taken to TFA elimination around the world. These have included mandatory limits and mandatory labeling, nutrition recommendations by government authorities, raising awareness, legislative and voluntary reformulation of TFA by food companies, and broader health and agricultural policies that try to address food systems to promote healthy substitutes to TFA. So just going to look at the examples from best practices around the world and see what we can learn from there. So Denmark is generally understood as one of the first countries in the world to eliminate TFA from their diet. So they started through legislation in 2003 that was based around a study that was done by the Ministry of Health in Denmark, and they legislated in 2003 to limit industrially produced TFA to 2 grams per 100 grams of fat. And in the legislation, they had specific penalties that they imposed for violating the limits on food companies. This entire process was stewarded by the Danish Nutrition Council, who worked on both research and steering the process of TFA elimination. They also did research that looked particularly at the consumption habits, not just of the entire population, but on subsections of the population divided by gender, class, region, etc., to figure out where exactly they needed to target their interventions. And at the same time, they also took the private electronic media along. So whenever there was research out on it, it was disseminated to a very wide audience through national television and other outlets. Next slide, please. The case of Argentina is also very instructive in how they took a multi-stakeholder, multi-sectoral approach. They started off with a baseline study conducted by the Ministry of Health and one of the premier public universities in Argentina. And essentially the entire process they followed was a very collaborative one, whereby industry and academia worked on developing replacement oils to PHOs in Argentina, which started in around 2001 and 2, and in a few years what this led to was a variety of TFA-free sunflower oils in the market with high oleic acid. This was followed up in 2006 by regulation to enforce mandatory labeling of TFA in products. and the formation of a commission to eliminate TFA. Gradually, Argentina made its TFA regulations stricter. First, it was 10% of total fats, then they reduced it to less than 2%, and in oils and margarine, then less than 5% in other foods. And the ministry published guidelines for small businesses on how to replace TFA. And again, similar to Denmark, there was also wide-ranging press coverage which helped the process. The case of Iran, we also looked at a couple of countries that were more similar to Pakistan in terms of the region and their social and economic context. So Iran was also pioneering TFA elimination. This started off with research in the early 2000s, which found that TFA was up to 33% in major fats and oils consumed in Iran. And they found that they did research on what would be the effect of eliminating TFA on the Iranian diet, and they found that they could prevent up to 40% of cardiovascular diseases if they reduced TFA. So this led to a national action plan by the Ministry of Health. They also took a multi-sectoral approach and negotiated with food companies from the outset. They started public education campaigns to advise the public about the harmful effects of TFA. And they also established a national committee. The first regulation they established was for 10% of TFA in oils, which was reduced to 2% in 2013. And through this multi-stakeholder approach, they managed to reduce TFA consumption from 28% of energy intake in 2003 to 5.6% of energy intake in 2009. So essentially, Iran, through following this multi-stakeholder approach and steered by the Ministry of Health, they managed to achieve far-reaching reductions in TFA consumption. Finally, in the case of India, again a similar socio-economic context to Pakistan. They also have similar dietary sources to Pakistan's for TFA in terms of banaspati ghee, bakery fats and shortening. And for policymakers in India, the question of the cost of oils and the availability has been a significant concern, because these are the major things, including in Pakistan, that cause so much of the population to consume partially hydrogenated oils, because they're cheaper, they're more stable, they last longer. And what Indian policymakers are also being very careful about is the question of caloric deficiency, because similar to Pakistan, fat intake is very low among lower income segments of the population. So what Indian policymakers are currently looking at, and this is an ongoing process, is how to balance the goal of TFA reduction with the goal of ensuring a sufficient fat intake, especially amongst lower income segments. And this is something I think policymakers in Pakistan should also be concerned with. So India has reduced, in 2 years ago, 5% TFA limit in vegetable oils. They are currently considering reducing it to 2%. And the complementary measures they're taking is working on developing replacement oils, investing in agricultural supply chains to produce replacement oils, and also improving consumer awareness. So India's is also an ongoing process, and we will know in the next year or two how successful their efforts have been. So what does the literature generally tell us from around the world in terms of best practices? One, that mandatory limits are the most effective way to limit TFA, rather than say voluntary limits or allowing companies to choose their own limits. Mandatory labeling is also necessary, so you can actually monitor whether companies are following regulations. There's the importance of stewardship by key government institutions cannot be understated. And all of the examples that we studied, there was one central guiding institution, whether it's the Nutrition Council or the Ministry of Health, that is essentially guiding the entire process. So we need similar stewardship here as well. You need multi-stakeholder approaches that involve government, non-government organizations, the private sector, academia, research institutions. You also need to complement limits and bans with research for what can replace partially hydrogenated oils. You need strong monitoring mechanisms everywhere, which can ensure that items that are violating regulations can be taken off the shelves. And you need, critically, evidence on what the population is consuming around TFA, and specifically also with regard to subsections. That has been very key for essentially monitoring how exactly regulations are being effective or not. So Dr. Tariq already covered most of this, so we'll just continue to the analysis. This has also mostly been covered. Just, yeah, he's also covered this, but crucially, these are some of the main industries that we need to be having a close look at. Edible oil, specifically with vanaspati ghee manufacturers, dairy, in particular the margarine manufacturers, and the bakery and confectionery sector, which is where a lot of products heavy in TFA actually end up for consumption. So these are essentially the industries we need to be closely looking at. As you already explained, the bulk of TFA is locally produced, and what complicates the situation in Pakistan in terms of regulation is that there are a large number of small and medium enterprises that are involved in the production of TFA, including particularly vanaspati. So this needs to be a very, so how we're going to essentially help those SMEs replace TFAs in their products has to be a key challenge that we are careful about. Next slide, please. Could we just continue? I think Dr. Tara has covered most of this. This has also been covered. Yeah, existing, just briefly, Dr. Tara has covered this in detail, but just briefly, Punjab currently has the most stringent regulations, including a ban on vanaspati ghee that is due to come into effect next year, and labelling requirements, and the lowest TFA limits across the country. KP is probably the province that has, following Punjab, has the most stringent regulations. However, they're still not as stringent as WHO standards require, while Sindh and Balochistan are in the process of enacting TFA regulations, where the federal government, the PSQCA, only has a limit for vanaspati ghee. As Dr. Tara pointed out, this has now been reduced to 5%. As opposed to 10%. However, this does need to be reduced further to come within WHO recommendations. Next slide, please. So just a brief overview of the key regulatory challenges that we face. We have historically had a weak food regulation framework in Pakistan in terms of enforcement. This has both been due to weakness of state capacity of regulatory bodies, as well as a certain degree of collusion with the food industry by political actors, by powerful interest groups within governments. And the key challenge following 2010 has been the fact that regulatory systems have been largely decentralized across different sectors. And so what we've seen as when we talk about regulations, that there has been fragmented and uneven regulatory changes and improvements. And also what we've been seeing is that there is, as in many other fields, a contestation of authority between federal and provincial governments that is currently in the process of being resolved by the CCI and the development of Pakistan standard. Next slide, please. Some of the key challenges that we need to address, and this is part of what we need, the policymakers need to think clearly about. One is the question of harmonization. So we have currently, this is a key challenge for Pakistan. For most other countries, there's usually one regulatory body, such as even in India, and they just enact the regulations and they're implemented across the country. In Pakistan, we have a slightly more complicated situation. So what we are suggesting is that limits should be harmonized, and preferably to the stringent levels that have been established in Punjab. So KP, Sindh, Balochistan and the federal level. And I think when we're talking about the development of Pakistan standards, we can talk about harmonizing limits for TFA in that conversation as well. And what's key in the question of harmonization is that that penalties are imposed for non-compliance. Unless we are actually going to penalize producers for exceeding TFA limits, then simply having regulations is unlikely to be very effective. Secondly, the question of vanaspati ghee needs to be carefully considered. The ban on vanaspati ghee, or as Dr. Khwaja pointed out, specifically partially hydrogenated vanaspati ghee, needs to be enacted across other provinces. This is something that is being fiercely contested by the Vanaspati Ghee Manufacturers Association, who are raising specters of trade conflicts with key oil exporters to Pakistan. But at the same time, the WTO's rules allow countries to impose bans that relate to the maintenance of public health. So this is something we can do. We just need to develop the industry, especially the capacity of industry, especially small and medium enterprises, to actually address the ban and reformulate their products. And this is really key because in Pakistan we do have a tendency to ban things without essentially figuring out what we're going to do afterwards, whether we're going to be able to effectively enforce the ban or whether we're going to be able to come up with replacement products that people will be able to consume as substitutes to PHOs. So this is something we have to think very closely about. Simply banning without thinking about replacements may not work, especially when implementation capacities are limited. Thirdly, the question of labeling has obviously been a key component of successful strategies around the world for TFA elimination. So we need to harmonize labeling, and at the same time we have to make the population aware of both the health consequences of TFAs and how to accurately interpret nutrition labels to ensure they do not buy products harmful for them in terms of trans fat and other sugar and salt contents. The question of assessment capacity is also very key. Before that, the question of intake. We do not have any data on trans fat consumption in Pakistan, specifically also around population subsections. We recently had a national nutrition survey, but we could not in time manage to incorporate a trans fat consumption component in that. So this is something that we again have to think very closely about. For the next nutrition survey, we need to, and even before that, we need to do studies that actually tell us what groups are consuming how much in Pakistan. Next slide, please. So this, in terms of enforcement and testing capacities, this is something that also has to be improved across provinces. This has historically been a reason why food regulations have not been strongly enforced. So this has to involve also including trans fat assessment in the rules and terms for food authority inspectors, so that they know what they're looking for and how they have to test for it. And this is something that has to be done across all food authorities. Similarly, we need to think about streamlining federal and provincial regulatory roles. As I said, this is already being mediated in the Council of Common Interest. Essentially what needs to happen is that all provinces and the federal level need to adopt the stringent limits that have been adopted by Punjab, which are basically less than 1% of trans fat in all fats and oils. Finally, moving towards improving public demand and awareness, Dr. Tar has already touched on this. We need to engage media and social media to inform the public about what consuming trans fat will do. We need to also support research for replacement and reformulation, particularly for small and medium enterprises. I believe the Sun Network and GAIN are working on a study which will help us understand how that can take place. And finally, as the literature from around the world tells us, we need stewardship. And this is especially important in fragmented regulatory contexts like Pakistan's. So whether it's Ministry of Health, whether it's WHO, and also obviously at the provincial level, we need key government institutions to take leadership in this regard and steward the process so we can actually achieve TFA elimination by 2023. Next slide, please. So just in terms of the immediate next steps, I think Dr. Tara covered some of these, but we are in the process of, the Ministry of Health is in the process of convening a national working group for TFA elimination that has key federal and provincial stakeholders and both government and non-government actors that can basically take this process forward and agree on a set of, agree essentially on a national action plan. And then we need to start disseminating key evidence around TFA, and this is like today is the first step in that regard, but not just amongst policymakers, but also amongst producers, suppliers, small and medium enterprises, and the public at large. So just the last few steps. Anand? So we've so this is just some of the outline for the plan. So we need to harmonize limits as stated. We need to work towards mandatory nutrition labeling, building awareness. Just the last two slides. We need to undertake a population level food consumption survey, build awareness of the health impact of TFAs, strengthen assessment capacity of provincial food authorities. That's particularly important. Sorry, the slides are now completely out of order, but it's fine. Need to strengthen monitoring and enforcement capacity of provincial food authorities, and undertake research on healthier replacements, and also promote those replacements through policies. The details of these can be found in our report. And I think it's very key, like part of what the recommendations are about and what we should decide also is who is taking responsibility for what. I mean, it's all very good and well to give recommendations of what needs to be done, but I think we need to be very clear on whose responsibility is. For instance, it's very clear that provincial authorities are responsible for enacting regulations and also implementing them. But at the same time, stewardship and coordination needs to be done by certain authorities at the federal level. So I think it's very important when we do our breakaway session today as well, that we come away with very specific sense on who needs to do what and within what time frame. So I hope we'll be able to have a productive and constructive engagement today going forward that can help us eliminate trans fats over the next few years. Thank you.
Thank you very much, Amar. I'm sorry, your last few slides are very important, but due to the constraints of time, we could not go through those action plan steps in detail, but these are very important and we will definitely look upon during the group work also later on. And talking about group work, the study that has been completed by Dr. Umar Tadar, we have not yet finalized it. We have shared the final finding, but we would like to get further inputs today, and that is why we have not circulated the printouts of the study. Earlier next month we would be carrying out an advocacy event based upon these two studies for the policy makers as well as the regulatory bodies, civil society for implementation, and in that event we would be circulating that study. Whatever has come out of Amar, it's very important. The issue of TFA is not very old, recognized in the new millennium, but immediate steps have been taken by most of the developed and developing countries, and we also need to move forward. Regulation and enforcement, that's what I always say. It is more important, regulation and important, whenever there is a supply side intervention. Awareness has very little role, but regulation and enforcement have the key role in supply side. So we have to focus on that. Plus the awareness and behavior change would continue. Harmonization is also very important, and we would like to hear the advice of Madam Minister on this, how we can move upon this and also cover the gaps. Nutrition labeling is another important event that has been covered in most of the regulatory authorities, but we also have to move on to front of the pack labeling, especially for TFAs and other harmful effect, and as pointed out by Amar, we would definitely look forward with the collaboration and cooperation of the partners to get the data on trans fat consumption, which is a blind spot for us in Pakistan. Before I request Madam Minister, I would now like to request the participants to please introduce themselves.
Assalamu alaikum ji, I am Asif Wahid, Project Coordinator for the Network for Consumer Protection.
Assalamu alaikum, I am Dr. Shirbaz from Nutrition.
Assalamu alaikum ji, I am Dr. Yahya, WHO, Punjab office.
Dr. Mazhar Khan, WHO, Khyber Pakhtunkhwa.
Assalamu alaikum, Nasir Muhammad, Nutrition Consultant with WHO Islamabad.
Assalamu alaikum, this is Javed from Zafrabad, Azad, Jammu and Kashmir Nutrition Program Manager.
Assalamu alaikum, Muhammad Abbas, Program Manager Nutrition, Government Activity Pakistan.
Assalamu alaikum, I'm Maryam Yunus and I'm heading Media and Communications in WHO. Assalamu alaikum, I'm Dr. Naureen Mishra and I'm working as National Professional Officer Nutrition and focal point for food safety, nutrition and environmental health. Thank you.
Assalamu alaikum, Dan Chashad, Singh Food Authority, Food Safety Officer.
Assalamu alaikum, this is Imtiaz Abdul, Director of Operations in Food Authority.
Assalamu alaikum. This is Zamir Haider. I'm National Program Manager for Edible Oil Fortification at TFA Food Fortification Program.
Assalamu alaikum. I'm Faraz Ahmed, Coordinator at North Communicable Disease Alliance, Pakistan.
Assalamu alaikum. I'm Dr. Shah, Director Technical Therapy Food Safety and Lab Food Affairs.
Asma Wala, Global Alliance for Improved Nutrition.
Assalamu alaikum, good morning. Dr. Naveed, Program Manager, Food Fortification Programs.
Assalamu alaikum. I am Atikullah, Deputy Secretary, Health Department for
Assalamu alaikum ji. I am Dr. Harun Khan, Director Nutrition, Health Department, Khyber Pakhtunkhwa.
Dr. Mukhtar, PCCR Karachi. Dr. Mukhtar, Food Technologist, PCCR Karachi.
Assalamu alaikum ji, Dr. Sabah from Heartfile.
Assalamu alaikum, I'm Jay Javed from Heartfile.
Assalamu alaikum, I'm Zubair from NFA.
Assalamu alaikum, very good morning, Dr. Noreen Arshad from UNICEF.
I'm Rashid from Heartfile.
This is Sarah Khalid, I'm the Nutrition Winger of the Ministry of National Health.
Assalamu alaikum, I'm Freak from Nutrition Program WHO.
Assalamu alaikum, I'm Sadiq, working as a Senior Program Associate for Nutrition Wing, Ministry of National Health Services.
Thank you very much. Now I would request Madam Sania Nishtar, for the Chief Guest for the event, for her words of wisdom.
Assalamu alaikum, ladies and gentlemen, and a very good morning. First of all, I'd like to congratulate the Ministry of Health and Heartfile and the World Health Organization for a very meaningful partnership. These three organizations have a very long history of collaborating. Not many people would know that the first coordinated national plan of action for non-communicable diseases was actually released in this room back in 2003 by the then First Lady. And it was a similar collaboration between Heartfile, the Ministry of Health, and the World Health Organization Pakistan office. That was the first plan of action in which all these four non-communicable diseases were clubbed together in an integrated fashion. And the common threads of prevention and treatment were identified in that plan. It is still accessible online. We did a special supplement of the Pakistan Medical Association with 13 papers on its design, and the Eastern Mediterranean Office of WHO called it the Model Public-Private Partnership. Of course, it's an interesting history on what happened to NCDs after that. And Heartfile is currently also doing a series of 10 country case studies on prevention that my colleagues Sabah and Amar Rashid are leading. And the story of what happened after 2003 to the National Plan of Action and how it needs to be revived is something, Dr. Kalitha, that I would like you to get personally involved in. And I would encourage Amar and Sabah to reach out to Dr. Kalitha more broadly in the construct of those 10 studies and specifically on the Pakistan case study as well. So let me confess, so this was a little bit of reflection back in history. I'm removed from Heartfile in my executive role. It's a small niche NGO which I founded 15 years ago. It runs thanks to the leadership of my colleagues now. I'm not involved in an executive role. I'm a servant to the government of Pakistan, and I'm very conscious about the firewall that I need to keep between my international work, between my role as the founder of an NGO, and between my role as fiduciary role as a as a cabinet minister now. I want to congratulate the leads of the two studies in particular. There are lots of lessons in those studies, and I think it is very important that we draw on that evidence. This is evidence for policy, which is why I'm very happy that the leadership of the nutrition division is here, because the role of a researcher ends when the galleys of the paper are given to you. Because I've been a researcher, so when the journal gives you the galleys, he says, my job is over now. But that is when the actual work starts at the nutrition wing. And that is the actual time when Dr. Padita will look at it in terms of how to bring to bear happenings in Pakistan to an international audience, because this is a very, the space of NCDs is a very resource-constrained space. We do not have the luxury of having all kinds of different studies in all kinds of different parts of the world. We have to learn from each other, which is why I was very happy when Amar presented the evidence from different countries to draw on what's happened and how Pakistan can learn from them. I really urge you to read the report with the red cover. A lot of work has gone into it, a lot of thought has gone into it, and a lot of, this is not a cut and paste job. I repeat, this is not a cut and paste job. This is real analytical work in which a lot of substance, so the substance has been driven, and the recommendations draw on that substance. As you all know, non-communicable diseases is the world's leading killer. There are some eminent journalists in the room. I would like them to pick this as a headline. Non-communicable diseases, which are diseases, this is a collective name that you give to heart diseases, to diabetes, to some cancers and some chronic lung conditions. These kill more people than all the infectious diseases combined. If you combine tuberculosis, malaria, HIV/AIDS, all the other infectious diseases in the textbooks, they will collectively kill less people than non-communicable diseases. And in fact, when we draw up a list of what is it that threatens prosperity, what is it that can wipe out the development gains of the last century? So there are 2-3 things that come to your, from a medical perspective. And even broader than that. So what is it that can destroy the world today? The Third World War can destroy the world today. If there is a celestial event and a meteor hits the planet Earth, it can destroy the world today. And then, of course, there are some cataclysmic health conditions that can destroy the world today. For example, uncontrolled antimicrobial resistance can throw us back in Stone Age. For example, if there is a pandemic today, which has this, and the virus has the same potency as the virus which caused the Spanish flu back in 1819, then in today's interconnected world, the projections are that a quarter of the world's population could die, and the world could go in the worst possible recession. And the third medical condition, which threatens to wipe out the development gains of the last century, is non-communicable diseases. Sadly, the world has not given due attention to non-communicable diseases of the kind that it deserves. And with my other hat, with my international hat on, as co-chair of the Global Commission on Non-Communicable Diseases, this is part of what we are trying to drive. An understanding that countries need to invest in the right policies. That countries need to invest in policies to promote physical activity, tobacco cessation, the appropriate dietary policies, and some cost-effective measures like screening for high blood pressure and treatment and primary care. Because this is what you need to address non-communicable diseases. Of course, there are things at the treatment end of the spectrum when the disease gets manifested, but there are things at the prevention end of the spectrum which are very cost-effective. A lot of these things will not cost anything. The recommendations that Amar Rashid is presenting to you is not going to cost the government exchequer anything. It is just about prudent policy. It's about transparent regulation. It's about effective monitoring. It's about having the right institutional arrangements in place. So when we talk about the diet piece in the NCD spectrum, you're talking about just a few things. You're talking about salt, you're talking about sugar, and you're talking about trans fats. And then diet has a double-edged relationship with non-communicable diseases, because on the one hand, undernutrition, even in utero, so if a fetus in the mother's womb undergoes undernutrition or overnutrition, the likelihood of that child having non-communicable diseases because of epigenetic influences, because of in utero influences, the chances of having diabetes and other NCDs later in life are much higher. So the public policy agenda centered on food systems and food systems transformation, of which regulation is a part, is hugely important in the non-communicable diseases public health agenda. I completely agree with Khwaja Saab because he said regulation is important. Regulation is a critical element of food systems transformation, and we have seen that from evidence from all over the world. So it's mandatory regulation with some very clear levers. It's a clear institutional responsibility within the government system, and it's even-handed, very effective monitoring. And when you talk about challenges, there are challenges at each level, because we do not have mandatory standards. And in a country where trade of services and trade of goods is regulated, is allowed under the Constitution, is allowed under Article 157 of the Constitution, I do not understand why provinces want to have their own regulatory arrangements. I do not understand why provinces have different standards, and this is not an issue confined only to the health sector. We see this issue in every sector, where provinces want to have a regulatory mandate in clear contravention of what the Constitution says. So clearly it is the Federal Ministry of Health which has the mandate to regulate, along with PSQCL, of course. PSQCL is a federal institution. It sets standards. And the Ministry of Health must work closely with PSQCL. In fact, back in 2013, when I was in the government for the first time, and I had played a role in the creation of the Ministry of Health, this was one of the mandates which was vested in the Federal Ministry of Health. There is no justification for the provinces to be duplicating that role. So the clear institutional responsibility, a very tight monitoring mechanism, a very tight, non-collusive monitoring mechanism which cannot be captured by the private sector, is the second environment. And of course the clear delineation of roles and responsibilities, which is something that Amar highlighted on several occasions. Then I think that the communication piece around this is very important, because ultimately diet is about personal choices. No matter what you do on the regulatory front, if I'm not convinced, it's ultimately my choice. What I buy off the shelf, what I cook in, is my personal choice. And I think that in terms of non-communicable diseases, there clearly has been a transition. I mean, I look at the breakfast table at our house in the morning, and you can clearly see the transition there. My mother-in-law, who has breakfast, will not want skimmed milk. She wants cow's milk, that's full cream, despite the fact that she's pre-diabetic and hypertensive. But that's a personal choice. I make sure I have skimmed milk. I've been conditioned. And my son does not have milk, he has green juice. This is a societal transformation that is happening. The key to NCDs is partly in the regulatory space, but it is partly in individual choice as well. Which is why the study that has been unveiled today is not just for Khwaja Saab's consumption. It is also for the consumption of the 2-3 media colleagues who are sitting here, because they must synthesize the right message from that And that must be the subject of key advocacy approaches. Because ultimately, whether I exercise, whether I, what I eat, regardless of what Dr. Palitha will tell us, regardless of what Tedros will tell us, is my individual choice. And unless we move the needle on that, we will not make significant change. So this is also my passionate plea to WHO, to the Ministry of Health, and to NGOs like the Network, to Heartfile, to many other NGOs that are here, that you must engage the media on the NCD's piece. And of course, we must have scientific papers from this. Because part of me is academic, and if it has not been published, it has not been done. So please get together. There are, and Amar can take a lead on that, and you should get some good papers out of this. So I want to thank my colleague Sabah. She runs the whole Heartfile engine now, and she does it with great elegance and integrity. I'm very proud of them. Once again, it's very nostalgic for me because I'm here as a government representative, not as your board chair, but I'm very proud of how you forged this very meaningful engagement. And I would like the nutrition division to draw on all kinds of expertise from the civil society. And as an elder in the system, Dr. Palitha, we look to you for your stewardship of this area. Thank you very much for having me.
Thank you very much, madam. And we would like to have an advance booking of your time during the first week of August. And Dr. Ayub is also here. And because madam has to leave for another meeting, I would request all the participants to please immediately gather behind the stage for a group photo.